Clinical quantitative psychological evaluation uses traditional clinical methods, but increases reliability and validity with the application of quantitative methodology. Currently, psychological and psychiatric evaluations are affected by examiner bias. In court, psychiatrists and psychologists are called by opposing sides to give conflicting views of the same patient. This has led to the perception that psychological and psychiatric testimony is unreliable and prejudiced by representing one side or another. Problems with measurement error affect more than just psychological evaluation. Medical tests and laboratory results can also be interpreted erroneously due to technical errors and examiner bias. For example, DNA testimony has been presented in court supporting opposing viewpoints. Why does psychiatric and psychological expert witness testimony have low credibility? How do mental health experts, supposedly following a scientific method and being objective, arrive at opposing viewpoints? Unfortunately, expert witness testimony is subject to examiner bias. Examiner bias is due to a number of factors, including training, personal background, and the referral source. Research has found that people cling to biases despite protestations to the contrary. This researcher found, through her experiments into memory, that bias is a part of being human. Every person divides up the world in certain ways. Most of the time, people show unconscious preference toward their social group. There is an aspect of our minds that operates largely in unconscious mode. We can say one thing and behave in a way that's completely opposite. Once, classical economics dominated policy thinking. The classical models presumed a certain sort of orderly human makeup. Inside each person, reason rides the passions the way a rider sits atop a horse. This viewpoint explains a lot, but not the current financial crisis. The current crisis has delivered a blow to classical economics and taken a body of psychological work that was at the edge of public policy thought and brought it front and center. In this new body of thought, you get a very different picture of human nature. Reason is not like a rider atop a horse. Instead, each person's mind contains a panoply of instincts, strategies, intuitions, emotions, memories, and habits, which vie for supremacy. An irregular, idiosyncratic, and largely unconscious process determines which of these eternal players gets to control behavior in any instant. For example, we don't perceive circumstances objectively. We pick out those bits of data that make us feel good because they confirm our prejudices. The typical examiner brings to the evaluation process skills that were gained while in various training programs. These programs vary and emphasize different viewpoints. For example, some training programs advocate a behavioral approach, while others teach a psychoanalytic approach. Continuing education offers many different viewpoints, often regarding the same problem. Another source of examiner bias is personal background. Childhood experiences, family background, socioeconomic status, and race can also have an effect on the examiner's view of others. The examiner's conclusions are affected by other factors such as attention to detail. How well does each examiner consider and review all the available information? Doctors are bright individuals who are highly trained in order to reach the correct conclusions. Consequently, they can become overconfident in their own opinion. Additionally, doctors believe that their approach is correct and most likely to be helpful. For example, a patient with back pain may be told he needs surgery by a surgeon, therapy by a physical therapist, psychotherapy by a therapist, and psychotropic medication by a psychiatrist. In this cartoon, The subject is feeling amorous. He says, "I consider myself to be ruggedly handsome." He is told, "You'd be perfect for Tess. She is looking for someone with a great sense of humor." Obviously, he does not see himself as others do. Another source of examiner bias is the referral source. That is, examiners often want to please the referral source in order to get additional referrals or to keep their job at a private or public institution. For example, diagnoses given at inpatient facilities can be affected by insurance considerations. Diagnostic decisions at mental health facilities can be affected by budget considerations. Patients often seek doctors that will tell them what they want to hear. Attorneys want to win their case. They want expert testimony that will further, not hinder their case. Consequently, each side in a legal case hires experts who have arrived at conclusions that are consistent with one side or another. The results of this study raised a concern that an evaluator's adversarial allegiance could influence some assessment instrument scores in forensic evaluation. Here, the examiner tells the patient that the lab results indicate your blood matches the blood found at the crime scene. But the good news is your cholesterol is down. The legal system is designed to be adversarial, using a thesis-antithesis model. For example, in an injury case, one doctor testifies that the person's injury represents a 100% disability, and the other doctor testifies that the person has a 0% disability. The two sides can then compromise at 50%. If a doctor more accurately opines that the injury was 75% rather than 100%, then this reduces the award for the patient when compromising with an expert from the other side who is claiming 0%. When they compromise, instead of being at 50%, the compromise ends up at about 38%. Even though multiple opinions may be obtained, they are still inconclusive because of possible examiner bias. The process of hiring experts for both sides is expensive and ultimately not conclusive. Juries also recognize that expert witnesses can be biased. Doctors often claim that their opinions are research-based. That is, their opinions are based on reading that they have done of the research literature. However, research-based evaluation is more than applying reading of the research literature in an idiosyncratic manner. The Diagnostic and Statistical Manual is an attempt to define criteria for mental disorders. The criteria have been established by a vote of clinicians rather than empirically validated. The criteria often require subjective decisions. The result is that diagnosis is not sufficiently reliable. Is psychology a science? Most clinical psychologists use a clinical rather than a scientific method. Clinical psychologists often use an idiosyncratic clinical method rather than applying the scientific method. Often what the public sees presented as scientific is actually clinical judgment, which can be inaccurate. However, the scientific application of psychological principles has been used with great success, including by government and private industry. For example, the military has used personnel selection with great success in placing recruits into appropriate assignments. Advertising has long recognized the advantage of using psychological techniques in persuading the public to buy products. The application of statistics to polling has revolutionized political strategies. Psychology is a science, but the application of those principles needs to be better applied by psychologists and psychiatrists in making decisions about patients. Psychological evaluation and testimony is usually judged by whether it has face validity. In other words, Is the psychologist's opinion consistent with common sense? However, this is the weakest form of determining whether what is being said is valid or not. Another attempt at establishing the validity of expert testimony is to appeal to authority. That is, the expert witness is presented to the jury as someone who went to a prestigious university, has published many articles, and is a member of professional societies. However, even highly trained expert witnesses are subject to being biased due to their specific training, personal background, and the referral source. Other types of validity are more accurate, such as construct validity and predictive validity. Paul Meehl was one of the first to point out that the actuarial method enhances clinical judgment. He noted that clinical judgment can be an error and that using statistical methods can improve clinicians' ability to make predictions about human behavior. For example, insurance companies successfully use the actuarial method to determine probable lifespan of customers in order to increase profits. Applying the actuarial method to diagnostic problems provides a number of benefits, including saving time, saving money, and administrative resources, and avoiding the negative effects of misdiagnosis. The solution to inaccurate clinical opinion is to use a clinical, quantitative approach to evaluation. By using an expert system approach, more accurate diagnostic conclusions can be arrived at by the consensual validation of an expert panel. The diagnostic opinions and decisions rendered can be studied to determine the accuracy of the decision-making process. Based upon the follow-up analysis, further refinements of the expert system can be made to better predict the desired criterion. Standard psychiatric and psychological evaluations use a clinical interview that consists of biographical information and a mental status examination. Some clinicians provide psychological tests. Many clinicians follow an outline during the interview process. However, standardized data collection is more than following an outline. Structured questionnaires can enhance history taking. The community standard is a clinical interview including the history and a mental status examination. This is considered adequately scientific. This cartoon notes that best practices can sometimes mean mediocre results. In order to evaluate any individual, a determination needs to be made as to the condition of that person's brain. In addition, how was the person's brain socialized or programmed? How well and in what manner the person handles problem situations, particularly under stress, is a result of the person's brain functioning and how the person was socialized. The person's brain-related abilities and socialization determines how effectively they will cope with interpersonal relationships and working. A clinical interview typically gathers biographical information including medical history and current illnesses and complaints. A social history including factors such as the person's parents, upbringing, siblings, education, and work history are also considered important information. The mental status examination determines if the patient is suffering from paranoia, hallucinations, and/or suicidal ideation. Some effort is made to determine the patient's intellectual level. While an outline improves data gathering, structured questionnaires can further help enhance reliability. In this example, a person is asked to rate their level of pain in various parts of the body as mild, moderate, or severe. Background information, including birth history, childhood development, and parental information, can also be gathered in a structured manner. In addition to applying history taking to social considerations, specific areas such as personal injury can also be subjected to a structured approach. For example, typical questions such as, "What was the patient doing when injured?" can be posed. Here, the patient is asked to rate the degree of pain they were experiencing prior to the injury. In order to enhance decision-making, some psychologists use psychological testing. The selection of tests is based upon the examiner's preference. While the data generated by the tests are generally objective, the interpretation of the data is subject to the idiosyncrasies of each clinician. In other words, objective data is interpreted in a subjective manner. Neuropsychological testing, such as intelligence testing, academic level, and brain-related tests often enhance clinical judgment. Personality testing can also be helpful. Tests such as the MMPI are known to provide objective data. Other tests, such as the Rorschach, provide projective test data, which can also be helpful but more subject to examiner bias. The first factor to be considered during an examination is the condition of the person's brain. Advances in neuropsychology have provided a valid method to understand and describe brain-behavior relationships. During the mental status examination, clinicians make an estimate of the patient's intellectual functioning. However, intelligence testing has been shown to be the best way to make an accurate estimate of intelligence. IQ is calculated by comparing the person's mental age to their chronological age. In other words, how well has this person learned, or how much information have they acquired compared to the same age peers? An IQ of 100 indicates that the person scored at the 50th percentile. That is, they have learned as much as half the population. If they have learned more than their same age peers, then the IQ score is greater than 100. If they have learned less than their same age peers, then their IQ is less than 100. To paraphrase Dr. Ratan, a person's brain is similar to others in general shape and appearance. For example, take a dozen eggs. Each appears similar to the other in size, shape, and color. However, if one was to take a dozen eggs and drop them, now each one is individual. That is, when they break, each one is different from the other. And when the brain becomes damaged, there's a high degree of variability in the effects of that damage. That is, when the brain becomes damaged, the damage produces numerous effects based upon the location and severity of the damage. When the brain becomes damaged, there is a high degree of variability in the effects of that damage. Here's a short list of some of the problems that can ensue due to brain damage. The number one effect of damage to the brain is difficulty with abstract thinking or problem solving. Conation is the ability to solve problems over a long period of time. Ratan describes the problem-solving process as being able to make relevant observations, picking out essential from unessential details, and forming a hypothesis or idea how to solve the problem, and testing out the solution. If the idea did not solve the problem confronting the individual, then the person makes further observations, thinks of another idea, tests out that idea, and continues until the correct solution is reached. The person's ability to solve problems will determine how well they adapt and adjust. Other difficulties due to brain dysfunction or brain damage include problems with memory, language problems, epilepsy, hyperactivity, autistic behavior, and mental retardation. It should be noted that hallucinations indicate brain dysfunction. Hallucinations are due to abnormal electrochemical activity in the brain. Neuropsychological examination includes empirical data collection, including testing motor functions on the right and left side of the body, such as with the groove pegboard test. In order to provide objective opinions, an expert panel can be used. This can be composed of 3 or more psychologists or psychiatrists. Panel members do not communicate with each other or discuss the case. They are unaware of the other panel members' opinions. Additionally, they do not know the referral source, so they can be unbiased. They are instructed to render the most precise diagnosis. They are told that their opinion will be compared with the opinions and outcome data. By using more than one expert, reliability is improved. Group decision-making is often better than relying on one opinion. For example, a jury relies on multiple opinions rather than just asking one person to decide. In this study, it can be seen that group decision-making increased reliability. In order to use an expert panel to assist psychological evaluation, panel members are given a video recording of the clinical interview. They review the records, including any test results. Their opinions are then collated for agreement, and an opinion is rendered. Each panel member's decision can be studied and correlated with outcome measures such as the other panel members' decisions and the trial court's decision. In a pilot study, 60 criminal cases, including adults and juveniles, were evaluated using an expert panel. Structured questionnaires were used. Structured questionnaires improve reliability over an unstructured data gathering approach. On this questionnaire, the doctor is asked to rate how likely the patient is to reoffend and how confident they are in this opinion. Here, the doctor is asked to make sentencing recommendations. Here, the doctor is asked about diagnosis. In this case, the doctor was asked to rate the likelihood of dangerousness. Here, the doctors are asked how confident they are in their opinions. Here, the doctor is asked about the patient's disability. After the doctors have rendered an opinion, a report can be generated. Psychological evaluation reports typically include a history of the illness or problem, current complaints and symptoms. Psychological evaluations often include information regarding IQ and intellectual functioning. Neuropsychological factors are discussed. This details the patient's brain-related abilities. Diagnoses are reported along with recommendations. Psychological personality testing can help provide additional objective data. This can include vocational information. Here is a printout of the MMPI, which is considered the gold standard of personality testing. Here, such factors as depression, psychopathic characteristics, paranoia, and schizophrenia are measured. Here are scales that help describe if the patient is attempting to fake good or bad. Here are scales that help describe if the patient is attempting to fake good or fake bad. Here is an example of a write-up of an expert panel approach. Here, the panel, made up of a psychiatrist and 2 psychologists, was asked, was it likely that the patient would reoffend? Here, we can see that the first 2 panel members agreed that the patient was somewhat likely to reoffend, and the 3rd panel member thought that the patient was very likely to reoffend. So we can see that consensus is that the patient is likely to reoffend, while there was some disagreement on how likely the patient was to reoffend. All clinicians agreed that he was likely to reoffend. Here, the clinicians indicated how confident they were in their opinions. Here, the same approach is applied to sentencing recommendations. For example, the first 2 clinicians indicated that they felt the patient should receive a minimum sentence, while the 3rd clinician thought a maximum sentence would be appropriate. So in this case, consensus of the expert panel agrees that the patient should receive a minimum sentence. Here, The panel was asked if the patient should be treated as a juvenile or an adult. Each question is tailored to answer the referral source's questions. Here, the results are displayed graphically. Questions regarding dangerousness are often requested. Once again, graphical representations. Note that indexes can be created. And here we can see that the panel's decisions can be quantified. While an expert system may not be better than an outstanding clinician, it is generally better than most clinicians most of the time. The outstanding expert who can make better predictions than an expert system is generally not available in most clinical situations. Even the outstanding clinician's predictive ability can be enhanced when aided by an expert system. To summarize, research-based decision-making uses statistical methodology to assist clinical judgment. This is adapted to answer referral questions. A population or referral base over time allows the use of specific statistical procedures and refining the decision-making process. In order to most effectively accomplish this, ongoing outcome research can be performed and data gathering techniques refined. An expert system approach can be used to aid in cases where there has been inconsistent opinions rendered. This may be due to ambiguous factors in the patient's history. Expert systems can also be applied in situations where an accurate diagnosis is wanted. By applying an expert systems approach, measurement error can be reduced in decision-making. As for cost, the expert systems approach generally is not more expensive than a standard clinical approach and may actually provide substantial cost savings. Most importantly, a quantitative approach to clinical evaluation can greatly enhance diagnostic precision.